Hi there. Without any doubt, the greatest boon to the skincare treatment is the introduction of tretinoin way back in 1986. Tretinoin, which is also known as retinoic acid, is considered to be the gold standard for the skincare. There is no other ingredient which can work as brilliantly as vitamin A or a retinoid. Depending on how quickly you want the results or how tolerant is your skin, you would choose your prescription version. So I'm going to talk about retinoic acid, a prescription-based retinoid, or whatever facts I could get. Retinoids are those game-changing ingredients which can treat a multitude of problems and cause major improvements in your skin. There's so many variations of retinoid which makes it confusing to know which one to try. The strength of each retinoid, it all depends on the number of conversions they take to get converted into retinoic acid. Each retinoid, when it binds to the retinoic acid receptor in the skin, influences the change in the gene expression. So let's understand vitamin A or a retinoid family more closely. So when it comes to active ingredient, vitamin A or a retinoid family is considered as a royal family, and there is no other active ingredient which works as closely as vitamin A. There's a lot of confusion surrounding around the retinoic acid and the retinol products available in the market. What does it do? What are the benefits? What are the side effects? So let's understand the prescription form retinoic acid. Retinoic acid, for which the brand name is tretinoin, is a zero conversion formula and is strictly sold as a prescription ingredient. This is the purest and biocompatible form, which means your skin receives the ingredient without any conversions directly. When the functions of the skin slows down due to biological aging or due to external physical stress, it works on the cellular level of our skin, reversing the appearance of fine lines, wrinkles, acne scars, and discoloration. So when you apply retinoic acid or a tretinoin topically, it helps the skin to work normally and in a healthy way. Since retinoic acid is accepted without any conversions or resistance directly into the skin, it is like two individuals with similar liking have got connected instantly. So you have to understand any form of retinoid has to be finally converted into retinoic acid to be able to perform in the skin. So what are the benefits of retinoic acid or a tretinoid? It makes your skin thicker. Because of the stimulation of the cell turnover, your skin feels more bouncier, smooth, and youthful. There are anti-acne benefits. It normalizes the keratinization, that means it clears off the dead cells from the surface of the skin more quickly. It prevents the skin cell from blocking and sticking together. So it leaves the pores open and clear and releases the bacteria and irritants which are causing acne. It also regulates the oil flow and prevents the future breakout. Tretinoin helps in reducing sun-damaged skin because of the quick cell turnover, and also reduces hyperpigmentation, dark spots, and discoloration. So, after knowing so many benefits of the retinoic acid, you must be raring to go to get your prescription. But before you go for this, it is very important for you to understand the side effects of this royal ingredient. But there's also a good news. The side effects can be prevented and minimalized with the right instructions and the correct dosage. And one of the most common side effects is excessive dryness, irritation, and flaking, especially around the corner of the nose, your eyes, and mouth. That's because this area generates more heat. So it's for the initial 2 to 3 weeks when your skin is still getting acclimatized to the new ingredient. Uh, the barrier layer of your skin will become weak and will lose a lot of moisture from your skin, making it very dry. Make sure to use low strength formula for at least 2 to 3 weeks in a gap of 2 to 3 days, and then slowly and gradually working your way up. Use non-comedogenic moisturizers with, which contain hyaluronic acid, silicone, your peptides, oils, etc. Also take a note that when you are using retinoids, your skin becomes sun sensitive. To avoid sun sensitivity, apply broad spectrum sunscreen with at least SPF 30 every day. Another thing which you may see as a side effect of using retinoid for the initial few weeks is acne purging. And that's because you may have underlying acne which has come onto the surface because of the quick cell turnover. So patience is the key for this. Retinoic acid or a tretinoin, which is a prescription-based form, is more potent than retinol. And that's a reason why prescription-based versions are more potent than the available over-the-counter products. Your doctor, after the consultation, will prescribe you the right dosage and the potency of the tretinoin. Tretinoin, which is also known as whole trans retinoic acid, has a zero conversion formula, which means it straight away penetrates and acts on the skin. There are four prescription-based retinoids, which are tretinoin, adapalene, your trazodone, and the fourth, which is a newly introduced retinoid, is known as trifarotene. Trifarotene is a new member of the royal family which has been introduced by FDA in the strength of 0.005% for topical usage of acne vulgaris. According to the studies, trifarotene is considered to be much gentler than even retinol. It has the properties of both retinoic and retinol. That means one part of it releases directly into the skin without any conversion, whereas the other part has a time release system and it releases into the skin over the period of time. So there are no or minimal side effects seen with this ingredient. So let's talk about tretinoin, which is the most common one and you must have heard about it more often. This is the active ingredient and doesn't require any conversion and is strictly prescription based ingredient. In its mildest form, it is generally used for treating anti-aging, whereas the stronger form has been used to treat for acne vulgaris. Second one is isotretinoin, which is also known as Accutane. Accutane is mainly used to treat. The third form of retinoic acid is adapalene. Recently, 0.1% of adapalene has been made available over the counter, whereas the 0.3% of adapalene is still a prescription-based drug. Thing which you should be really careful about while using any form of retinoids is its application and dosage. There's this misconception that the higher the strength, the more effective will it be. Just as you won't take overdosage of your prescribed antibiotics, same is with your retinoids. More is not good. Due to individual variability, some people may experience overall a very good results and some of you may not be able to tolerate it so well. Second thing which you have to be really careful about while using retinoid is do not use your retinoid more than the pea-sized amount. Using more than pea-sized amount will increase the irritation and dryness. As a beginner, start applying the product every third night within a gap of 2 to 3 days and use it in a low strength formula and then gradually working up once your skin starts tolerating it well. So who should and shouldn't use retinoids? You can start using retinoids as early as in your early 20s or 30s as a preventative and a regenerative photoaging measures. So let's talk about few general queries. Will prescription retinoids thin out my skin? No. In fact, these ingredients are actually known to thicken your skin by promoting collagen and elastin production. However, it can compromise the barrier layer of your skin if your skin is naturally thin. So go easy with your prescription retinoids and train your skin to tolerate it well. Which non-prescription retinoid is best for you? With any non-prescription formula retinoid, it is very important to know how your product has been formulated, what is the percentage of the product, and how is it being delivered into the skin. Remember, retinoid is one of the trickiest ingredients to work with, and you will never achieve satisfactory results if the formulation is not proper. Packaging of the ingredient should be in an opaque container to maintain its stability, even if it's in an encapsulated form. Go for a trusted, reputable brand. It must be formulated by a skilled and an experienced lab. Remember, you have to be very patient while using any versions of retinoids, because retinoids does not have an immediate results. Once your skin gets acclimatized with the product, have patience, don't lose faith, keep using it for at least 8 to 12 months to see the desired results. If you have liked my video, please hit the subscribe button or press the bell icon next to it so you are the first one to know when I upload a new video. Keep watching the videos, stay healthy, stay glowing, because beauty is skin deep.